Justin Block calls Mississippi home, but you won't find him here all 12 months of the year.
I had been a nurse in an ICU in Oxford, Mississippi for 15 years, and I decided to start travel nursing after that.
He decided to pursue travel nursing in 2012. And much like the rest of the world, he never would have imagined a pandemic in 2020.
Because it was unknown at the beginning about the virus and what could happen, the isolation was the strictest we had ever experienced. And because of that, you're having, now these patients are sick and they're requiring so many different types of equipment in the room.
After a trying year of skyrocketing COVID cases and overwhelmed hospitals, travel nursing soon became a key asset to help battle the virus. According to data collected by the Mississippi Center for Quality and Workforce, the number of traveling employees saw a 144% increase from 2019 to 2020.
So when hospitals don't have enough and they've tapped on their full-time people, their part-time people, their PRN nurses, and they don't have anybody to help care for this surge in number, then one resource is turning to travel agency nursing.
And as travel nursing became a demanding resource to help for the rise in infection and hospitalizations, the demand in money increased as well.
The pay is the biggest part. The pay increased dramatically during the COVID because of the shortages that everyone just needed. And so, yeah, the pay really attracted a lot of people.
When you get offered $160 an hour for RN in an ICU setting or more, people are like, well, if I'm working in COVID here, I might as well go and work in COVID somewhere else and I can make big money.
As a result, many hospitals, long-term care, and other healthcare facilities are left at risk, especially those in rural communities. In a statement by the Mississippi Rural Health Association, they say the long-term impact of this is often detrimental, especially to our rural hospitals, since they do not have the funds to hire travel nurses in the long term. We are also greatly concerned over the morale of our full-time nursing staff that have been steadfast at their local hospital, who are now working side by side with travel nurses who are not from the community and who make 40 through 50% more per hour than the full-time local nurse.
In 2020, for RN turnover in long-term care was 70.9%. LPN turnover was 66.5%. CNA was 94.1%. So almost a complete turnover of nursing assistants.
And while Mississippi currently has calm waters when it comes to COVID cases, health leaders fear that another surge could be a different story. Now the Mississippi Hospital Association Foundation and other health leaders are working together to develop retention programs and other solutions to retain nurses in the state. One way, keeping an eye on student nurses. Weems says if things do not improve, they may have to scale back on hospital beds to accommodate for the nurse staff.
We struggle with what are we going to do if we have a bad flu season and we have a bad COVID season. What are we going to do? And, you know, some of our nurse leaders said, I don't even have a plan B right now. I think we're going to have to match our workforce to the number of beds available. And that may mean waiting in the emergency rooms longer, waiting in the doctor's offices longer.
Kara Peters, 16 WAPT News.